3, 2, 1, go.
Welcome back to the Swish Summit. I am Dr. Coach Kev. This is
Josh Correa.
I'm messing nothing up. This is
Alexandra Falconer.
Yeah.
all right. I feel like in the last episode I said Dr. Kevin Melendez. Whatever you want to call me, Kevin, Kev, Mr. Melendez, Doctor, whatever you want.
What do you want? Doctor, though.
Yeah.
All right. I earned it. Not me. He did.
I have the
Anyways,
school loans to prove it.
so I figured today we could talk a little bit more about you, Allie, and kind of what got you started in massage therapy. Like, what was your journey to get there?
Ooh, super fun.
I know.
I feel like
I should just give you the mic. Why am I still? No, I was saying, why do I have the mic? I should give it to you.
No, you're fine. I don't mind. Massage therapy, I mean, I guess you could say since I was young, I loved sports. I was intrigued with, what the human body was capable of. If I'm being honest, I used to watch Naruto.
Hey.
Yes, I used to watch Naruto, and then I ended up on YouTube, and I ended up watching, like, do you remember those videos of people doing incredible things? And it was like a mixture, and they have it on the Onion channel or something like that, like the chive.
Okay. Yeah, I know what you're saying. Yeah, I've seen it. I've seen it like sports bars. I would be like,
But
oh, that's
they
crazy.
like people would like do like these crazy flexible things. They would be like walking on lines, stuff like that, like bending their bodies, like lighting themselves on fire. So I used to watch like no, I know it sounds so weird, but no, really. But
You
like,
ended it with the lighting.
no, like stunt people.
Yeah.
No, I get what you're
People.
saying.
Yeah,
So-
just incredible feats.
Yes,
Yeah.
of people doing amazing things. And to me, I like as like a little 12-year-old kid, you know, I was like, this is insane. Like, how are these people doing this?
Yeah.
And just seeing athletes push their bodies, professional athletes at the age push their bodies, I was like, how are people doing this? I'm just this kid, watching these videos thinking, what? That's possible? And then the older I got, I started participating in some sports, and then from there I wanted to see what I could do. I started doing boxing and MMA at like 18, 19.
Oh, wow.
And then after that, I used to just go for runs, like 6-mile runs. And I just kind of kept following that passion of like trying to discover what my body was capable of doing.
Yeah.
And before you knew it, I ended up moving away from home. I pursued school for personal training. Then I ended up going to school for massage therapy. And then as of like a year and a half ago, I went and got my precision nutrition cert for nutrition, obviously. And I don't see that being the end goal for me, but in all of that time, I'd say in 10 years, powerlifting kind of came into my life, bodybuilding came into my life, cross training came into my life, and I participated in those things, just trying to figure out, okay, if I saw these videos as a child, what can I do? And I want to put myself through it and really understand it. So that's where my journey came to being a massage therapist now.
So what about, because you kind of point out a few different professions in that, which I love that you were willing to go, okay, how can I challenge myself? But what actually led it to being the choice of massage therapy?
I was just passionate about it. I love helping people. And during the time of like trying to pursue those athletic things, I ended up getting injured myself. I got injured, I would say I was 16. I ended up in physical therapy for the very first time. I don't even know how I injured myself, but I remember I ended up being there for like 6 to 9 months. And it was because my glutes weren't activated, and the physical therapist, she was able to help me. I couldn't even bend over, which kind of sucked. I couldn't hinge my hips. I couldn't do anything. And I ended up getting massage therapy while I was there. The physical therapist worked with me, helped me kind of move my body again, learn how to activate my glutes, hinge my hips, things like that. And then I had to go to physical therapy one more time when I was like 22. And that one was an injury. That one sucked. That I couldn't walk, my knee was messed up, my hips were messed up. And during that time, the physical therapist helped me again and said, I don't want to see you in here again. Like, please stop doing what you're doing. There's a lot of repetitive action that you're doing to your body, so please take care of yourself. And then I really just wanted to dive in. I was like, okay, how can I understand my body and just make sure I'm not messing it up? And
a part of what you learned from that was like, okay, in order to avoid injury, I have to have some sort of self-care recovery routine. And then that's where massages became a normal part of your process. And then that's how you realized the importance of massage therapy. And then you're like, wait, what if I can help other athletes or other people in general live healthier and happier through this skill set that I take a part in as well, or you take a part in as well?
yeah.
Okay, that's dope.
So going along the journey, like adding in massage therapy, learning more about my body, learning more of like, okay, if I do too many actions like this is what's going to happen. So I need to make sure I get my massages twice a week or 3 times a week, especially since I would train like
For a high level athlete.
yeah,
Okay.
yeah, I would train like 5 to 6 days a week, and I was just like, all right, something's gonna give eventually, right?
Yeah.
So I have to make sure that I'm taking care of myself. I have to make sure I'm eating, I'm drinking, I'm actually getting my massages, whether it was like a deep tissue massage or making sure I would get my feet massaged, or okay, this is what I'm preparing for this event. I need to make sure that I'm getting my back massage, whatever it was during that time. I was either getting massages, or one time I put myself in physical therapy just because I told myself, I was like, all right, moment of reflection. On a scale 1 to 10 right now, my pain level for my hips is like a 4. I don't want that to go to a 7. You know what I mean?
I love that. I love that. I love that because what you just said is my biggest motivation in physical therapy, and why we even created Swish and what we're doing is to change the narrative of physical therapy does not mean when you're injured.
It doesn't know.
It is people. I love to educate people in knowing there's 3 different types of care. There's primary care, secondary care, and tertiary care. The healthcare system only cares about tertiary care because that's where they make the most money. And that part care is when people are injured. Secondary is where you were in. Hey, I'm kind of bothered.
You have to sit and like,
Right,
sit
I'm
with
kind of
yourself and realize
bothered.
that, though.
Yeah, I'm kind of, but like, is it enough to go to PT? If we change the narrative, it is. Go get it checked before it gets worse. And then there's primary, which is nothing is wrong with me, but I'm going to make sure my vehicle stays completely fine, and I'm going to come in and get checked regularly, either annually or biannually, to make sure, okay, yeah, I am good, I am running good. That way it doesn't get worse and worse.
Yeah.
So I love the fact that you did that. Goes to show how different you are, and the possibility that our mission and our goal here is extremely plausible.
And she applied the big thing, I think, which is huge for not just in health and fitness, but just in general in life, is be proactive instead of reactive. So she saw I'm at a 4. I'm going to be proactive right now because I don't want to get to a 7. I have to react to whatever injury I get, or the pain.
You're absolutely right. Like, I knew what it was like to get injured. I knew what it was like to not walk, and it really sucked. That's why I think Caroline, what's her name, my physical therapist, she taught me a lot. Yeah,
shout out.
I do miss that woman. She was amazing. She taught me a lot, but I knew she was like, all right, we're only going to see you in here twice because you're not that bad. You're okay. You
Exactly.
can walk, you can move.
Exactly.
But since you're saying you're at like a 4, we want to just make sure that you don't get any further. I was like, all right, sounds good. I was only in there like twice, and then I just did my exercise at home, and I did it every day before I do my lifting session as well. So after that, I was like, oh, okay. I'm good. So I was happy about it, and I was like, I don't need to go then. If I just stay with my exercises and keep going, I'm okay.
And then get checked every once in a while to make sure everything's still running smooth. My question, I have an additional one, is for you were an elite athlete who was training pretty often. I would say 5 to 7 times a week, or what's your
not 7? No.
5 to what?
No.
What do we?
5 to 6 days a week.
Okay, 5 to 6. And you were saying you do about 2 to 3 massages a week. Is that what you were saying you do on average, or what would you recommend to somebody, either somebody who's an active athlete to somebody who trains to stay healthy versus somebody who's just has an increase in stress, and those kind of things? Like, how would you recommend how much they should get, when they should get a massage?
I mean, if you're talking about an elite athlete,
those 3, yeah,
an elite. Well, we'll start with the first one. An elite athlete, like you're probably, if you're working towards a goal, which I'm assuming you are. You're going to want to get a massage like once a week, or you're going to want to get specific work done in order to help you maintain a certain range of motion, or maintain a relaxation or a calm nervous system, anything. The second one you said?
More of they just try to stay active and make sure they live more of an active person, not an active athlete, right? Somebody who's like, I go to the gym to stay healthy.
Oh, those people though, those are fun. Because let me tell you, like, those people, sometimes they don't even do their mobility exercises, and they're actually a lot tighter than what they would think. You would think that they're like, oh no, I'm just going to the gym, I'm just lifting heavy weights, and I'm like, but your lats or your shoulders are super tense, and they're like, yeah, but I'm good. I'm like, because your mindset is like, oh, I'm okay with just that.
Yeah.
They're not working on their flexibility. They're not working on their range of motion. They're just like, I'm just, ugh.
So what do you recommend for them?
I would say like once every 2 weeks.
Okay, once every 2 weeks.
Once every 2 weeks, let them get their work done, and then after that, give it like a month, they'll be fine. You know what I mean? But once every 2 weeks, because they're not really focusing, like I said, on their flexibility, their range of motion. They're just trying to lift heavy weight.
Yeah.
Gotcha.
Yeah.
And then what about the common, even less than that, just someone like our mom, like my mom, or like your mom, whatever, someone who's like
I wish I could.
not training 3 to 4 times a week or 5
Yeah.
times a week, just like every so often, or daily exercise.
Yeah.
But I wish I could really like narrow it down, because it really comes down to the person.
Always,
Like,
always.
because like you can get your mother who comes in and she's having like emotional stress. Her nervous system is shot. She's taking care. She's moving things around. She's helping the whole family. Getting a massage once a month probably is not gonna. I mean, it can aid and it can help her.
But it won't be enough.
It won't be enough. She's got to be able to communicate to me, and me have to be able to understand her to say, oh, okay, she needs a little bit more, or she might need this, or not need it, but want that.
So
Yeah.
my take is so what it sounds like to me is like an average of like once a week.
Once a week or once every
Once
2
every
weeks.
2. Okay, that's good.
Yeah.
That's good.
Yeah.
That's good. I've never
It's
been,
so
been able to ask that.
Yeah.
So
See, I had a question.
Yeah.
I was curious. So you mentioned personal training, you mentioned nutrition, education, and then obviously massage therapy. Out of those 3 practices that you learned and like studied and got certified in,
Yeah.
which do you feel like you learned the most about the body? Or, like, would you think it was like in personal training or nutrition when it came to like the food and how that affects the body, or massage therapy of like, oh, if I'm massaging this area, how that's connected to
Our
these
knees
other
are
muscles?
touching.
Oh my goodness, how dare you! But and how that how everything's kind of connected to each other. Which of those 3 kind of opened your eyes to the human body and how it works?
I would definitely say massage therapy.
Yeah.
I had to be in tune with myself even more. I had to be able to give back to somebody in such a healthy state. So when I was in class and I was learning, when all of us were learning these techniques, like, you're not just learning to like, oh, let me.
Yeah. Oh, it
You
feels
know?
good.
Yeah,
But
exactly.
Yeah.
Denzel.
Get your hands. Yeah.
No, like, I learned so much about like just being able to be still with myself and really feel somebody's warmth, feel their
Tension,
their
yeah.
tension, feel like the range of motion in their ankles, the tendons, the ligaments, the muscles. Like, that was where I learned way more. I can understand nutrition and learn about that and how it can help give fuel to the body, but really being able to go in depth with touching the body was it for me.
Yeah.
Good.
Dope. Any closing questions that you might have?
No. I'm good.
No, I mean, truthfully, the only thing I would say, I guess I'll put my owner hat here and say, if you want to schedule a massage with Alexandra Falconer. Did I say it wrong? I said it wrong.
Say it again, let me hear it.
Alexandra Falconer.
There you go. You changed it. You changed it. You did.
You can do so at getswishpt.com/massage. You can learn more and schedule on that site. So thank you, and we're really excited to have you a part of the team.
Oh
Thank you.
yeah. Oh yeah.
Thank you. All right.